Hello, welcome everybody to the Retirement Success in Maine podcast. My name is Ben Smith. Allow me to introduce my co-hosts, the Timothy Berners-Lee and Neil deGrasse Tyson, to my Bill Nye, Curtis Wister, and Austin Miner. How you guys doing today?
All right. Doing
Good.
well. I think I'm worried here. We're getting a little smart with these names. I don't know what's coming here.
Exactly.
I agree.
Well, and I think it'll be apparent to everybody. They'll go at some point in the next minute or so. They'll go,
Yep.
"Okay, I get it. Yep,
Yep.
yep, there it is."
Absolutely.
Well, and of course, one of the things when we sit down with many of our clients, we've been hearing, obviously, just not, they want to talk to people with intelligence as we are, but not to that level.
Yeah.
But one of their greatest fears in retirement is needing long-term care services as we age,
That's right.
right? But I think the hard part is, like, as they're asking us, right, is, hey, what's my long-term care need going to be, right?
Sure.
But we're not medical experts. We don't have the crystal ball to break out to know exactly what people's future is. We don't know when people are going to pass away, right? We don't know any of that. So, but we do know a little bit about maybe how our immediate family has aged,
Yeah.
right? We know what their experience with maybe long-term care has been. But the question I think that gets asked about to us is that relevant for
Yeah.
me?
Yeah.
Right. So, as financial advisors, we spend some time with clients thinking through what that experience might have been, and using averages, we can estimate what a cost might be.
Yeah.
So, the loss of personal independence due to care needs becomes more likely as you age. And with proper planning, long term care can be a dignified experience, free of burden for the individual, but also their loved ones. And just to give you some statistics about how widely how important long-term care is in the U.S. alone, 70% of Americans are going to require long-term care.
Yeah.
91% of them are going to require their family members to step in, and 54% will not be able to afford the 140,000 out-of-pocket cost to pay for the care they need. So with our clients, we can, again, as we said, we can roughly game plan whether our current retirement assets and savings might be enough to support one or two people's long-term care needs. But it's certainly a guess, and it's somewhat rough, and it only discusses the financial component of long-term care. What about the burden of my family? What is their role going to be, and how should they be involved in my aging process? Is it possible to strategize an elder care strategy for each of us individually? So that's exactly what our show is about today, strategizing my elder care journey.
That's right, Ben. And like all of our shows, we like to bring in a guest. So our guest today, our guest parents came to the United States, each without a penny to their name. Her dad came from Thailand, where his formerly wealthy family lost it all due to the war. Her mother came from Cambodia, narrowly escaping the Cambodian genocide as a child. Our guest personally grew up in a low socioeconomic community and has been privileged to have helped her parents rise to a middle class through their entrepreneurial endeavors. So, our guest has spent 4 years specializing in molecular genetics and data science at UC Berkeley and did all things technical foundations, including biology, chemistry, physics, data science, computer science, statistics, and linear algebra. She has
As
spent
one
the
does.
Yeah, exactly. She has spent the last few years pushing for the early adoption of AI in biotech and healthcare. So again, our guest today is an ex-NASA data scientist building the future of financial planning tools for elder care using artificial intelligence, or again, AI. She is the founder of Water Lily Planning, a software that leverages AI to help you personalize your long-term care plans. So with that, please join me in welcoming Lily Vatire-Ruxkull to the Retirement Success in Maine podcast. Lily, thank you so much for coming on our show
Awesome.
today.
Thank you for having me.
Well, Lily, of course, with all of our shows, we want to hear a little bit about you and get to know you a little bit first, right? So, want to just kind of hear a little bit about your parents' journey and how that influenced your life and your academic pursuits, and why data science.
These are really good questions. So I'll share a little bit more that you probably can't see online or read
Mhm.
online, which is like my dad actually never had an opportunity to pursue higher education. Instead, he actually ended up working day and nights with the smaller businesses that he built together with my mom in order to get my mom through her higher education. And so my mom ended up getting a master's in business. And so that opened up a lot of opportunities to pursue bigger, more strategic, I think, business opportunities, and really opened my eyes as to how the right sort of educational path leads to the right career path that could lead to more stable wealth, which is seeing that progression of like going from in poverty to having more stable wealth was really eye-opening to me. And that made me realize that I didn't want to pursue education for the sake of pursuing education, but actually as a way to optimize the career path that I wanted to build for myself. And so I wasn't interested in data science actually by itself. It was only in context of another field that I was already fascinated by, which is genetics. So the difficult
Mhm.
thing about genetics before we had 23andMe and whatnot is that it relied a lot on archaic algorithms that no one understood. We were just taught to like, memorize these really complex algorithms to solve for this use case in genetics. And at the same time that I was studying genetics is when data science opened up for the first time, to undergrads at Berkeley. And I just saw this huge opportunity to leverage that big data approach to data science, to genetics. So.
Mm. Very
Oh,
cool.
that is very cool. And very excited to talk to you today. This is really neat stuff. So, what I wanted to ask you is, so how did your data science background, artificial intelligence, and long-term care turn into a business for you?
So I was actually fast tracked as a young kid into aerospace engineering. So I did not at all like build this career path. I think things just happen to you, like life
Mhm.
just happens. So when I was doing my internship at JPL, the robotics side of NASA, when I was a teenager, that's when something happened in my family where one of my immediate family members was diagnosed with cancer. And so for a little over 2 years, we had to navigate our own long-term care event where for we saw her health drastically decrease. And her room, we had a two-story house, we had to move her room to the first floor, just all like the aspects of taking care of her physically, emotionally, and the financial like surprises mimicked a lot of the same devastating effects of families caring for aging loved ones, like our aging parents. And so that made me pivot my career from aerospace into healthcare. I kept my technical background in machine learning and AI, pursued that for a little over a decade in the healthcare industry. And I realized that, it's been a little over a decade later and not much has changed for families on this topic. And no one was really looking at it from that more empathetic view.
Mm. I appreciate that insight and background and want to kind of fast forward to today, right? And Water Lily. So can you just kind of walk us through Water Lily? How does your software generally work and what are the plans for you in the future with it?
So, an advisor or an advisor's client today could actually fill out an intake form where we ask a little over 2 dozen questions about the client. We ask basic demographic questions, basic health, basic financial,
Mhm.
and in about 1 or 2 seconds, we actually take that data and run them through our AI models to build out these onboarding slides for our client that an advisor can present. That essentially tells the client their long-term care story,
Mhm.
specifically the cost and care trajectory, if and when they were to need long-term care.
Wow.
Well, Lily, I know we're going to go into kind of a lot of things and what your software is doing and what it's working on, and really the subject of our show today is strategizing our elder care journey, right? And obviously our team has been beta testing that software, right? So we've been going through. It is completely fascinating.
Hmm.
We're really kind of shell shocked with how much it can kind of transform, I think, a lot of these conversations that we're having with our clients today, or even the conversations we've been having on this show. All right, we're at this point we're episode I think in the mid 90s here.
Yeah.
Um, So let's kind of start with some foundational items here. What are some key motivating factors for engaging in long-term care planning?
So long-term care is an extremely common event in retirement, and extremely expensive, and often burdens like children and spouses extensively. And what's surprising is that paying more for long-term care today is not necessarily equated to having higher quality of care. And so by if you start planning today, the gist of it is that you actually get a shot of changing those negative outcomes, any of those outcomes with our software.
Gotcha. So, and one thing to be clear is, so this isn't the Trojan horse software to then sell long-term care insurance through Water Lily, right?
I usually joke sometimes, so I'll just be very clear so it doesn't get
Right. Yes.
confused.
Yes.
Because we don't sell any insurance product on our platform, and we don't plan to sell any insurance products.
Awesome.
So I'm really fascinated to learn more about the data process here. So when we're dealing with clients, it can be a tough thing to talk about because there's so many different variables. So your website talks about using over 500 million data points, I believe. How are you able to draw conclusions from quantitative and qualitative data to create relevant output for end users?
So I think it helps to, I think that's such a great question. It helps to contextualize the data a little bit more, which is those 500 million data points actually refer to individuals that we're currently tracking in retirement today, or who have recently passed in retirement. And we know essentially their entire retirement picture, but we mostly focus on, if they went through a long-term care event. We have the level of detail of which daughter stepped in for how many hours for what physical limitations during this time. Did they also experience additional hospitalization or nursing home visits, and how did those care needs progress over time? So in other words, we followed that entire multi-year story for almost 50,000 lives and we have equal representation of demographics across the US in order to minimize bias in our algorithms.
Okay, interesting. So you said you follow like real life situations and you're mapping that for data. So
Yes.
how do you ensure that your data is like relevant and up to date as time goes along?
So for what it's worth, we don't go and gather this data ourselves from the population directly. We don't, create the surveys, and we don't have APIs directly to these individuals. We actually have both public and private access to academic institutional data as well as government institutional data. And we stitch that all together to essentially build out up to 20 years worth of data on any one life that we have. And those data sources are actively getting updated multiple times every year, actually. So we're always improving that, and we're always gathering new data sources today, especially with our upcoming pilots with some enterprises to further build out the fidelity of our data sources.
I love that, Lily. And you just teed up my next question perfectly. And I really want to get to the kind of output here, right? Where you're gathering the data is up to date, right? You have all these sources, all the different data points. I want to know how you're actually able to identify unique costs that then can be personalized for each user, right? We all live in different places. We all have different challenges, right? For example, how are you able to predict that maybe it'll cost me $55,000 annually for in-home caregivers, or then another, $1,500 for medical equipment, or maybe $7,000 for installation of shower grab bars, right? This is the kind of output we're getting. Can you speak to kind of how that's happening and how it's accurate?
So I'll share first off the potential of our data, which is we have a massive amounts of historical data across home care versus institutional care, what are even healthcare costs, and being able to tease that away from long-term care costs.
Mm-hmm.
And associate that with conditions of a particular individual and their care journey.
Sure.
Where we particularly focus on today is specializing in care hours and separating family care hours versus professional care hours. And we also ask in our intake form, hey, what is your zip code? Because knowing where you live has a drastic effect on what that cost of, getting those caregiving hours done, important, as well as what's subsidized by family members, but also what care environment are you going to be in as, you have growing care needs over time. And whether you choose a facility or aging at home, and the design of that also drastically affects your cost. And so we gather all the, your facts and your preferences in that, intake form to be able to make essentially the projections of where you're likely going to live, how are family members going to step in for how much, and how much care hours are you going to have over your long-term care event, which all contribute to cost.
Yeah.
So Lily, I think just kind of helpful to maybe give an example. So I in terms of just picking on myself here a little bit, I of course went in and used myself, right? Is go in and kind of create, go through the survey, answer about things about my family and my history and current family relationships, right? And again, I know this is there's still a little beta mode happening here, right? So anything I say, I just want to say is like, well, hey, this is just kind of what we're working on today, right? And we're kind of still there. But let's assume Water Lily's in its final form. I've gone through the onboarding process and the survey. And so after that, so here's some of the output I got. Just so people can hear this as an example, I think is helpful, right? That Water Lily assumes that I'm going to need 9,144 hours of care. And the net cost of care is going to be $67,710. The prediction is that I'm 49% likely to need long-term care. And there's a confidence levels that you're giving there, right? So it's 71% confidence of that being the number. And that I'll likely need long-term care at 81 years of age. And that's a 73% confidence. So again, so 9,100 hours of care of a span of 6 years. Again, highly confident in that, 76%. So what's simply amazing, right, is that you've gone kind of further than just going, well, here's a number, right? Yeah. Here's a dollar amount saved to it, which I kind of feel like as financial advisors is kind of like what we have, right? Is, well, there's some averages and estimates and those sorts of things. So you've now gone further than just here's some hours, here's some dollars, but you then mapped out my family's investment in my care. Right. So you're showing that professional services of the 9,100 hours, that I'm going to need 3,500 hours of professional care. My wife is going to provide me about 3,500 hours. I'm not going to tell her that part yet. My son's going to provide 1,800 hours, and other family's going to chip in for another 257 hours. So what's really cool about that, right, is so then the next step is then we go answer questions about my wife and my son and my other family. Like, well, geez, my wife, maybe my wife is debilitated, right? Maybe she's a quadriplegic and she can't take care of me, right? So then I can allocate hours to, well, let's insert another family member or another friend, or so we can then start mapping out not just the cost, but it could be, hey, here's kind of how we go through that. So talk to us about mapping out those family roles and how you created Water Lily and why that's important to truly get an accurate picture of our personal care.
So simply put, it goes back to the data and just like how much it lays out that work for us, which is if we know which daughter stepped in for, this particular household who had these demographic information and had these diagnoses associated with them, then what we're essentially doing is we're mapping you to historical lives that we've had that look like you and that look like your family structure, and how did they go through long-term care and how did family members step in. And so we took all those lives that looked most likely like you, and then we built that regression to the average of like what is the most likely proportion of hours that your spouse is going to take on, or your children or other family members, versus a professional. Simply put, it's like we're mapping you to, we're not making our own like fancy algorithm of building this growth rate of like family involvement, but actually it's the way to explain it to clients is like we're just mapping you as close as possible to other people that look like you and they've already gone through this. This gets really interesting because what we've done is we've opened up some insights that you've never had before. So it's an interesting psychological experiment, because now how does that affect your intention with how you want to go about, aging, or who do you want to involve? I think it looks different to just let it happen to you versus you now know what's going to happen, and you probably have a opinion on what you want to change about it as well.
Yeah, and Lily, and I'll just kind of follow that up. Is I thought was the fascinating insight is like, not that you're just doing data and then just saying, okay, well, this is likely your experience in terms of financial, which I think is the default mode of us as financial advisors is, well, we only care about the money, right? So here's the money and here's how much you have, and let's get the overall out of pocket cost out of this, and now we can work on it and we can build around it and we can talk through it, where kind of going that extra step of, well, we really got to talk about aging process just generally with your entire dynamic, because all of a sudden if somebody can't step in or things are changing in your family over time of, hey, this might shift more costs or less costs here, right? And how you're cared for. So it's going to impact the financial part because of, so I thought it was really brilliantly done about kind of inserting that family dynamic and mapping that relationship out, so that I think we're just going to get more accuracy with our clients because of that. So it's just I guess a highlight. I just wanted to insight, maybe not a question, but just something that I thought was well done.
No, I appreciate it. I think it's pretty profound how you encapsulated that by yourself, about like, wait, Lily, there's all these variables that affect cost, but these are actually much more profound relational conversations to be had with the client as well, that just makes doing our job better, or more effective.
And I think what's worth seeing is that it's a very natural thing, I think, for people to talk about from an estate planning perspective, is they go, okay, when I die, here's the natural power of attorney and executors of my estate. And there's like, well, I can't have this person do this because they're probably not likely to be more inclined to do it. Or, we got to think about the relationships of people. So I think we're more okay talking about, I want things to happen a certain way when I pass, but we're less likely to talk about how we want things to happen as we age and we maybe lose capacity. Just seems like a weird, I don't know, conversational conflict that happens there.
I think, to be honest, this probably goes to my personal philosophy, like on this topic. Is the more fundamental psychological question I think to solve is just like, aging is actually really scary, and I think the scary part is the fact that we've associated our sense of identity with being able-bodied and being able to do a lot of things by ourselves as an independent person. And during that time we define our identity, our like who we are by ourselves, and build our own families. And once we lose that physical ability or even cognitive ability, do we still now know, who we are? And so I think a part of solving this problem is being able to look at our trajectory and start to build out more resiliency about who we are outside of our physical capabilities. And I think that'll make us be more, effective and satisfied with the decisions that we make.
Mm-hmm. Yeah, I definitely agree with that. I think it's nice for people to have a tool to use to actually enact that as well, because I think it's something where they feel like they hit a dead end a lot of times, right? So, but kind of going back to Ben, using Ben as an example here a little bit further. So just to help our listeners understand how dynamic the process is here. So, using Ben as the example, what happens if, say, his son gets married and he now has grandkids that he's close to that would chip in for care? Or what about the opposite? How would you map it out if family moves away or Ben and his wife retire away from their family? What would that look like?
So the really cool thing is that this isn't a one and done situation where, like, if Ben mapped out his trajectory today, his snapshot, we actually do ask, like, on a yearly basis, if you could just double check your data to see if anything major has changed. Because if not, you're now a year later and you're still in this state, that's information to us that may help us build a more accurate snapshot of what your projection is going to look like. So if something changes, where we now have a particular grandson of interest that like wants to like step in more, or the daughter who's going to be the secondary caregiver that was going to devote 2,000 hours, she now is like living much farther away, and her personality is such that like it's not obvious to us that she would move closer if your need were to arise. And so we want to remove her from the picture and recognize, okay, maybe we're covering that gap with like our grandchildren that we're really close to, at least to the best of my knowledge. Because I think that's the best we could do is, take into account how the most dynamic thing is our relationships. So how are our relationships changing over time, and how does that change my care plan and my financial plan?
I love that. And it as you were explaining that, Lily, I couldn't help but think about kind of our roles here, myself, Ben, and Austin. And, when we have these conversations with clients, it's all I was hearing was how important it is to stay accurate and up to date, right? We can map out these financial plans for someone, and then 5 years, a lot can change, right? So it's very important that this is just an ongoing part of your kind of planning process. So I really appreciate that. I want to keep going a step further here. I know part of Ben's example there involved family and caregiving. On a previous show or episode of our show, we had a guest on by the name of Iris Weichler. She was a caregiving expert. So we talked with her about really the emotional weight of taking care of our family, right? The three of us, Ben, myself, and Austin, were located in the state of Maine. And so in the state of Maine, family caregivers were actually reimbursed for up to $2,000 annually. That's part of a program called Respite for Maine, me. And we have a link to an article of kind of Forbes there that we can probably put in our show notes, kind of talking about that program. But so essentially, these family members, right, can get a bit of help, right, with the money, with current demographics. Obviously, here in the state of Maine, there are many aging members of our communities that need support. So I guess what I'm getting to, Lily, as a question for you, can our family structures, how they are today, continue to support our aging population, do you think? I know that's a loaded question.
I would say that family involvement, I think we're only going to receive more and more pressure to have that be inevitable in our care plan, because just of limitations in our healthcare system and how many people it actually help out. But the hard part is, I think we have a pressure more now than ever before of with the strained healthcare system and long-term care systems, whether it's like government or private,
Sure.
We feel this pressure to step in, but our workforce doesn't look the same as it did before, where previously it was optional for let's just say of a nuclear traditional family for the wife to have to work.
Sure.
But because of economic conditions today, we in order to survive, essentially we have to have a dual income household. And so now you have a lot of women entering into the workforce now more than ever before as a requirement, but they still have to take on the caregiving duties of if they raise, having children, raising those children, trying to grow in their career in order to earn enough. But then all of a sudden we have aging parents right around the corner that we have to take care of.
Exactly.
And so it's I think that for traditional caregiving structures in the household, I think a lot of women are still very much going to feel the pressure to have to take care of our in-laws or our own parents, and reconcile that with how am I going to financially, be okay as well. So that's the tricky problem we have at hand.
Yeah, and Lily, I know obviously caregiving is such a big thing, and you raise just a really great point that basically some of the deficiencies in the healthcare system just kind of falls to our family members and community members to kind of step up and help out, right? Is that there's somebody has to do these things, and there's people that need care, and these people that we love and we want to take care of, and we want to help out, and we don't want to see them struggle. But one thing that we had an episode way back, it feels like at this
Yeah.
point, 60 episodes ago, Dr. Sarah Zeff Geber. So we talked about solo aging, is that there's a growing population of people, they've been married, but they don't have any kids, right? So they've taken care of their parents, right? But they go, who's going to take care of me? And she really talked about that was a really big concern for her in solo agers was, hey, to what you just raised as a point of, it falls on people in my network to take care of me as I age, as I'm not able to do so. So, but I don't have family to then rely on at all. So I have to then reinvent in my network over time and continue to reinvent in future generations of friends to ask them to help out and advocate for me because no one else is able to do it.
Mm.
Right. So my question is, how would you think about Water Lily here and your software counseling? And again, our roles as advisors using this software to counsel that population to think about their long-term care needs if they don't have family to assist them.
So, in terms of immediate family members, we definitely take that into account. So in the initial intake form, we ask if you have a spouse or a partner and if you have children. And if you respond no to any of those, we actually pull that into our predictions of like what are similar client profiles such as yours where they also did not have a spouse or a partner and they did not have children. And so what we map out in your family or in your support structure then for any family involvement is that a smaller subset would then just fall on other family members. So this could be, a younger brother, it could be it could be your niece, your nephew. Like, I don't want to discount the fact that there are sometimes family members that you are close to that aren't just your traditional immediate family. And so we encompass that in other family members. But then you're right, a large portion of that ends up falling on professional care services. So we show that, we show how much of those care hours get shifted to professional caregiving, which also then, automatically is associated with higher costs of care. I think also I'll share an example. Like my partner's grandma, which I have a really great relationship with her, and I really love her. She is widowed, and what she done is I think where I see a lot of single individuals going, which is she lives in a community actually, and you're right. She's built out all of her friendships over time, where she's in her 80s, she has friends who are 90s or in their 70s, and they're all very close knit with each other. They have like book club and they look out for one another. And if one of them's like really depressed, she's gonna go to their door and bake give her some pastries or cookies and check in on her. And I think that that's such a wonderful form of support actually in like the communities. Like you actually all live together. And my partner's grandma has also she's also actively put together her care plan of just like, I already have these are my advanced directives, and I started looking into like independent living or assisted living, or that could also cover like nursing home, and like this is what I'm looking for. She actively has those conversations as well, and she lets everyone around her know these are my like wishes and these are my preferences. I want to go to this specific facility, and it's that level of, I think, direction that not only gets really precise about what the costs are going to be, but also gets really we get really confident about what are her supports in place, and she's like designed that. So that's just like separate from our predictions. It's just how do you go about building your care plan after those predictions to just make more educated and informed decisions.
So that brings up a kind of really important point, and I think about our financial planning process and just using this as a parallel to it, right? Is to say, okay, so as we're going down a road with somebody and we're 20 years in and we can go, geez, this is what we've spent and this is where we are and this is where we have left to go. And I'm just thinking about that of like my father-in-law just had a medical event, ended up in the hospital, right? And got care, and he's, see good recovery, everything's gonna be fine. But I'm just thinking about, so say we sit down with him as a client and we go, okay, so we update maybe those sorts of events to you. Would how would that change, right? So it's like, so we did the initial onboarding and we go, the client's had a medical event, right? And they no longer have an organ or whatever happened there. Is that going to change kind of? So if we're updating this continually with you and we're going with Water Lily, is that going to then go, okay, well then based on this, we had confidence you were going to have 9,000 hours of long-term care, but now based on this knowledge, more than likely you're going to need 12,000 or 5,000. How does that change over time in terms of the client journey?
So I think it's in a nutshell, it's similar to just like what your new snapshot of what your health looks like. We then look at people who look like you that went through those diagnoses and also those events as well. And how did their long-term care event play out? Because we have so many, lives in our data set and it's only growing. That's just building our confidence on like, okay, like this is how it's going to change what what the projected long-term care event's going to look like for you. So you're right. It might actually mean, 5,000 hours because it looks like you are going through these acute things faster than we expected, which might mean like accelerating through, having more and more care needs faster. Or it might actually mean that like, hey, we noticed that someone when they had an initial like scare or like surgery in their 50s or 60s, all of a sudden they did certain things that like to make themselves more stable and healthier, and then health is more top of mind for them now, and so that means they have like better behaviors. It's just, there's all these subtleties that we try to capture in the intake form, and that's why we don't just ask, tell us your health condition. Okay, it's here's your outcome. It's more about like, who do we think like who are you, like who are you really, both, and just like externally how you identify things that you've been through, your financial picture, which gives us a sense of your socioeconomic status, in what region, to really try our best at understanding like the unique predictive variables about you, and try to give you that as insights. I don't know if that was a clear answer.
No, I think it is, because I think where we're trying to go is, hey, we're on a path, and we're again, we're strategizing the journey. We're not just strategizing the first step, right? Hey, we're 88 and here we're having acute medical issues very routinely, and what does it look like for me kind of going forward? And maybe based on where I am, it's just helpful to then understand this in terms of affordability, but also my care plan and who's available to me. Because what if my spouse is predeceased me at this stage, and now I was planning on that role, that caregiver giving me those hours, and now that's not there, and I have to readjust the whole thing. And maybe people are, as you said before, maybe people can't do those roles. So it's just re-strategizing continually is what I'm hearing you say.
Well, exactly. And I think we're actively getting more information on this like right now, where we have upcoming pilots next quarter, where it's actually focused on populations that are going through care right now, and how could they potentially use our software to re-strategize, how they're leveraging their financial resources, how are they leveraging their current upfront, like, family caregiving resources, versus how can we spread that over time? Or how can we recognize, wait, if the daughter's going to spend 5,000 hours on my care, that seems like too much for her, and she's also verbally saying this is too much for me, then we can use our caregiver assessment of just saying, hey, objectively, who else in a family should we identify as potential caregivers? Let's go through the assessments and figure out whether or not they even be a good fit, to then have a conversation about spreading those family caregiving hours amongst more individuals. So we're in a really interesting time in which, if we tell someone their projections, how is that going to illuminate back to us what someone's preferences are, what someone's motivations are, and their psychological profile? And I think that'll further help us better guide more precise projections of like, we think you want to actually go in this direction versus this other direction. Is that true? Things like that.
That makes a lot of sense. I wanted to zoom back out a little bit. So obviously there's a huge, I love this software, by the way. I think it's such a useful tool for so many different age ranges, right? So obviously the focus turns towards long-term care as you're 50, 60, 70, aging. But I think as we saw with Ben's example, it's a really valuable thing for younger people to be utilizing as well, right? So with that being said, we're looking at the future of long-term care, specifically in the US. How do you see the future of long-term care evolving? And are other countries' models influencing how the US is caring for its citizens?
That's a really fascinating question, right? So I will share it's like the aging innovation landscape is drastically changing, right now. For what it's worth, I think government is stepping in more now than it ever has been before into making sure that the population is prepared for long-term care. Like, for example, there's a lot of state mandates that are like slowly unrolling, with Washington starting first and requiring either you pay a payroll tax or you purchase a form of like long-term care coverage. I think there's like some caveats on like implementation, of course, but California's fast following that, and there's a few other states where it's going to be a mandate to actually have some level of coverage. To ensure that like financially we're somehow getting prepared for that. I don't have an opinion on if it's going to be beneficial or not. I think it's always based off of execution.
Sure.
There's also across each state, like we have our Medicaid programs as well, and our Medicare Advantage like programs, where there is now this stronger emphasis on LTSS, which is like the long-term care like support systems. And so they're actually coming up like the program you just talked like that was just shared about in our particular state, family caregivers are actually getting compensated by by Maine to take care of like aging family members. I think innovative measures like those are only going to increase today on the like from the state. They're actively looking for ways to better manage the aging population. From a, I guess, like private industry standpoint, I speak to a lot of founders like myself who are in the eldercare space or in like the eldercare like financial services space. And we recently had a fascinating conversation that was organized by one of my investors. And he asked, like, outside of what you're doing, just like what is, if you had unlimited time and money in the world, like what would you work on for this space? And the most interesting answers were people that said, I want to build communities that mimic blue zones across the world. So more specifically, like really focusing on a sense of community, reducing loneliness, like eating better, like factors that we've seen across the world, where people are living a lot longer than our average life expectancy, up to like what we call the centenarians. I might be pronouncing them wrong. But people who live above 100, like what are they doing across the world that allows them to live to 100? And so a lot of us entrepreneurs are really fascinated by that, and we're trying to see how can we build mimic that sort of blue zone as a way of promoting not just extending up to 100, but like also creating higher quality of life at the same time. So I see all sorts of ideas more in spirit of a blue zone.
Yeah, and Lily, I think that's really fascinating because MIT Age Lab, I know they have their own kind of research that they're having, and we had a gentleman come on from Hartford Funds, and they have a good partnership with MIT Age Lab, and that's kind of what we're talking about. Was I think not necessarily blue zones, but they're saying how really a lot of successful folks as they age, that they were really being successful around college campuses, right? Is because you get multi-generational populations there, right? So it's not just, here's my gated retirement community and we're all the same age and we all age together and we reinvest in other people that are of similar ilks. It's like, well, no, that when there's activity, there's things like sports or academic things or theater, or there's things to do, and there's free access to healthcare typically, or there's access to healthcare typically. There's access to athleticism and gyms and things like that. I can go on walking trails and tracks and things. Like, it's kind of like that was kind of a takeaway that we thought was pretty fascinating. Is like, hey, that actually was attracting more. You think it was attracting college students, it was attracting retirees as a fascinating thing. But Lily, I want to ask another question here, and I know it's a little impromptu, and but we talk a lot about kind of the journey, and I know kind of for us as advisors, right? And I know we're interacting with your software here, and the question I think that then is being asked of us. So I thought I'd just ask you a similar question then, is, okay, so the questions being asked of us from our clients is, okay, well then if I know how many hours and I know what the investment in my family is going to be, how should I pay for these services is a question, right? So, because you talked about Medicare Advantage, you talked about Medicaid. Obviously, there's long-term care insurance. We kind of joked about you're not selling, and neither are we. but there's lots of different ways for either out of pocket to all these different avenues here. And I just want to get your take on that, and not going into anything specific, but just generally, like how you'd want the advisor community like us to interact with your software to then make those recommendations.
So we're actually in the midst of developing this internally, which is more the financial planning aspects of the software. So I'm really glad that you all find the current software useful. We're massively improving it right now to solve for a lot of the advisors' key pain points, where the first one is like, okay, if I know the cost, and the client's just like, so what are we going to do about that?
Sure.
And the main pain point is like the client does not can't, like, they're having trouble, like they oftentimes have trouble understanding what is the difference between self-funding, partially insuring, or fully insuring, just like as three fundamental concepts, and get them to make a decision on like one concept to go with. So the way we solve for that is we've actually built out this financial calculator that once you know what that cost is going to be, we then have these basic fields, and I'd love to get your feedback on it, like probably at another time.
Mm-hmm.
Basic fields around like self-funding of just like, how much have you set aside for like long-term care today? And the advisor gets to decide what is that ARR on self-funding vehicles, like whatever you want to put in here. Then we tell you we just calculate what is expected monthly contribution over the period of time up until their care age that they're going to need to put in to cover their cost of care at the age in which they're going to start needing care. And so we then calculate what is that total principal investment that you're going to be making. So that's a dollar amount to focus on, which is like how much you're going to invest today. And then if you added a policy of any sort, I don't care if it's life with a rider or hybrid or traditional, we just ask basically, what is that total benefit amount? And what is that monthly contribution rate? Because then we understand, okay, if the coverage is 350 and your long-term care is going to cost 700K, we just automatically cover the rest through the self-funding, and we show you the new principal total investment. And so all a client, I think, needs to understand is like, how does your principal change as you consider different methods? And the advisor could potentially talk to them about, outside of the quantitative number, what is the qualitative differences of going with one versus the other, which I can't speak to, but someone might prefer to be more liquid today than, later on, or things that you could talk to them about. But we focus on one single number to simplify that financial story so that they could decide, oh, well, I prefer to be more liquid today. So I think a partial insuring route generally makes the most sense. That I think will take an advisor so much farther than there are today, which immediately the only solutions are, here are these policies, here's the illustration for them, which are very hard to understand. And where we're going past from there is like, okay, we helped an advisor potentially help a client make a decision today on what method, but a client might still say, well, okay, great, I'm going to partial insure, but I'm going to wait 5 years. I'm going to wait 10 years. Like, we're on the same page. I just want to focus on this later. And so we actually have a toggle for the time value of money, where if we said, okay, if you want to start 5 years from now or 10 years from now, how does that change the total principal you need to invest if you started then? And it's drastically higher, and people don't recognize that. And so we're just building the visualizations of calculators that already exist, so that the advisor can solve for the client wants to make a financial decision now, and they know the type of financial decision. Now it's just on the advisor on what specific individual vehicles do you now pick to align with that strategy. And so in our new form of our client profile, we're actually opening up the dynamic expense graph, and we're allowing you to put in individual like vehicles, so that if you put in a policy, it might have a max benefit amount of $250 a day. So we could tell you through the expense graph that like, hey, it's going to cover up to these 4 years out of these 6 years, and then you have this extra gap of like, we're maxed out at this like max daily coverage, and we've taken into account your overall max benefit. You haven't hit it yet.
Wow.
The rest of that, how does that get covered through some self-funding vehicles? So we're going a little
Really
bit
cool.
deeper.
Yeah.
Really
So
cool.
I'm going to go ahead and just pull up my calendar so we can book another episode of the show when that calculator's out, and we can go through it with everyone. I think, speaking for Ben and Austin, that just sounds incredible. And I think something that's would be incredibly useful. Lily, I want to just take a second. So we've kind of reached the end of our conversation. So I first just want to thank you again for coming on our show, sharing your expertise, sharing your software with us, letting us dive into it and really show people what's out there. I do have one final question for you. I hope you've got your kind of crystal ball out, if you will. So the name of our show, right, the Retirement Success in Maine podcast. We like to ask all of our guests, how are you personally going to find or define your personal retirement success?
How am I going to defined or find?
Yeah, I guess either one, right? What do you see as being a successful retirement for yourself?
I think it's I honestly think it's an active learning journey to define what my personal retirement success
Yeah.
is going to. And I think I'm learning. I think it's going to change as I learn so much from talking to advisors like yourself, like following, your podcast, where there's just all these new kind of concepts of, setting up your goals for retirement, or, what are some important financial strategies that you should be aware of, because I think we're now in this era of like technology and access to information, where I think I just want to use that to better consult with financial professionals about like, what should I do next. Like it shouldn't just be them telling me what to do, but I think we're now in an era of how can I get empowered with the topics to then want to bring up with any financial professionals, or for me to do myself.
Yeah.
So I think that's how I would find personal finance, like retirement success, is actively learning and finding the right influencers in the space that know what they're talking about, are always trying to learn themselves. I think that's a really nice way to stay on top of, our method. And in defining it, I think that's just like I love that you have conversations with your clients, because I think it really is all about just really having a really good sense of who I am, what are my values, and recalibrating, financially, like, do I have enough for my goals, actually in retirement. I think that's going to change. I should have them today, so that I could, know how to invest appropriately. But then 10 years from now, it's probably going to change. But as I mentioned, it's better to make financial decisions today to the best of your ability versus waiting 5 or 10 years out, because that could be so much more expensive to do and way less affordable, actually.
Absolutely.
Well, Lily, thank you so much for coming on our show. This is a lot of fun. I know you're well on your journey in terms of you're shaping the financial services industry. We thank you for that. You're shaping not only us but our careers and our clients. So keep going. We're cheering for you. We want your company to be a success. Keep us in the loop. But thank you so much for coming on our show.
Yeah, of course. This has been a pleasure. I think Ben, Austin, Curtis, it was a pleasure to meet you all, and wonderful questions as well. And I think that if I was a new person like listening and I was just like, wow, these are really insightful to just get that precursor into the space. And also I love it. It also shows me just how much you all care about being on top of your financial planning game. So it's been amazing.
Thank
Appreciate
you.
it. Yeah, thank
Appreciate
you so
it, Lily.
much.
Thank you.
All right. Be well. Well, I can say we had a lot of fun talking to Lily Vaitai-Ruskell today. I mean, it was, just talk about her background. You can tell just the intelligence coming through, and obviously what she knows about a space, and basically you're just a NASA scientist as a teenager, right? I mean,
Yeah,
I can't put
I
that on my
wanted to dive
resume.
in on that for a minute too, by the way. We might have to have her back because she quickly threw in that she interned for NASA as a teenager.
Yeah. It's just like working for NASA, just in my teens,
No big deal.
I mean, I can say I wasn't a NASA scientist as
I
a
was not.
teenager, but
Exactly.
Nope.
but yeah, you just kind of, I think, obviously very impressive of a background, impressive what she's working on today. You can just tell she has a lot of momentum behind her in making an impact in this long-term care space. And I know that's just an area that it's going to impact all of us. And as we talked in our intro, it's just a large percentage of us are going to be in that position. So here's somebody that's coming up with a really great way to plan for that those events, and helping our advisory committee on trying to create solutions. So we are going to have actually some more information about Lily and in her company Water Lily on our website. So you can go to blog.guidancepointllc.com/95 for episode 95. Find some more information there. Have our transcript and some links to the show. But we really appreciate everybody tuning in. I know we went a little technical here and there, but thanks to you all for tuning in and staying with us. And we'll see you on episode 96.